we're going to move on to the next session, and we're going to be into the sub-themes, and the first sub-theme that we shall be looking at is technological approaches in food systems. We have a number of presentations, and possibly I would want to confirm the following persons around. Elizabeth Imbo will be starting us. Then we'll have Stephen Ochieng. Stephen Ochieng, let me confirm, yeah, he's around. Stephen Onyango, he's around. Violet Musau, yeah, she's there. Then once we are through with those 4 presentations, we shall have some 2 poster presentations. The 2 poster presentations are not necessarily in the current sub-theme that you're exploring, but we've thought well to slot them there because an opportunity arose, and we decided to give those participants that opportunity. So I would want to invite Elizabeth Imbo to start us off with her presentation.
Thank you very much. Good morning, everybody. I'm delighted to be here to share with you some of the, not findings, but some work that we are implementing in a project that we call Nutrition in City Ecosystems. But before I do that, at least I have the latitude to react to Daktari's insects presentation. And I was going to say that for us to ensure that people are more acceptable, then we also need to invite, for instance, our chefs, and then we work on better recipes. Recently, I got an opportunity to eat a bean-based menu, and you would not tell that you are consuming beans until it was said to us. And then we started thinking around the years that we ate beans in school in the form of githeri, and we hated it, you know. And here we are talking about beans and saying, you know, we need beans, you know, it's, you know, better protein, and the same thing with insects. Okay. So my presentation is on digitalization as a key driver to sustainable food systems. This is part of a project that is financed by the Swiss government and implemented by 4 agencies in Kenya. We are working in Busia and Bungoma. And I just want to give some context to this, some of which have been spoken about by both Daktari and Professor. Professor, interestingly, we have a history as classmates, but now he's now my senior. Thank you so much. So in terms of the context to how we ended up with the Nutrition in City Ecosystems project, we appreciate that malnutrition is a big problem. So globally, up to 30% of the population is malnourished. I think about 11% severely malnourished. And then we have another 2 billion people who cannot access nutritious food. They cannot access the safe food. And this is from the latest reports on the food security and nutrition. And the reason why this is happening is also myriad. I mean, Daktari spoke about the desert locust pandemic that we had, and then we also had the COVID, and then we have the Ukraine war, and for the last 5 years we've been having drought, you know. So all these things are interacting and contributing to the problem of malnutrition. Then I will move to the sustainability bit, which is around the environment, and Daktari has also talked about it. I will make references because I felt like his framing remarks really gave a good foundation to my presentation. So within the food system space, again, 30% of the greenhouse gases is coming from the agriculture sector, where all our food is coming from. And apart from that, we're also suffering from a problem of loss of biodiversity, all right? There was reference to sorghum, because we have commercialized, you know, maize and rice, you know, and wheat, and we forgot about the sorghums. We are also commercializing the chicken and meat, and we are forgetting about the insects. So again, we need to rethink about this as we talk about the food system space, because we want to have a sustainable transformation. And then there was also the concept of urbanization, all right? So at the moment, we are about 50% who are living in urban areas. In the next 20, 30 years, we'll be talking about 70%, okay? This food, where is it being produced? It's not being produced in the urban areas. So what do we need to do to ensure that we are strengthening our food systems to feed this population that will be in the urban areas? So this project has looked at all these components, and we have thought it wise to create a flagship that will enable us improve the health and nutrition for urban population. And of course, we also want to ensure that while they're doing that, they can also earn some income. We are quite interested in reaching out to the women and youth. This is because of, systemic marginalization that has left them out. Now, this project has 4 outcome areas, but I will make emphasis on 2 outcome areas, on production as well as demand generation. And within our project, we have a social business model that we're calling the Farmer Hub. So this is a last mile service delivery solution that ensures that farmers are able to access farm input at affordable pricing. But the same hubs are also offering an opportunity to aggregate produce that they can reach the markets, and of course from the markets then we can reach our consumers. While we are implementing this project, we are very keen to address some key elements that will help us address the environmental sustainability. And at the bottom you can see we are trying to promote diversity, so diversification in production, resilience programming, efficiency in as far as use of farm inputs are concerned, recycling, as well as respecting the culture and food traditions of the people. So in our project, we have focused on 5 specific value chains. Key among them is indigenous vegetables, that is the African leafy vegetables, sweet potatoes, chicken, and fish, as well as groundnuts. As I mentioned, this project is being implemented in Busia and Bungoma, and as part of our project input is ensuring that we are building capacity, but at the same time providing digital solutions, and hence the background to my presentation. Now, this digital solution is an app. We call it the Soluta Ag app. And this app enables the farmers or the producers to interact with agripreneurs, enterprises, as well as forward markets. And for this to happen, they need to install the app. And once they have installed the app, they are able not only to transact, but also to establish a marketplace where they can sell their produce. The beauty about the app is that it enables real-time data that can be used for both decision making. So whether it is market intelligence, product pricing, as well as who or your market to buy the product, they're able to access that through the platform. In our experience, since we started the project in 2021, we have been able to train about 92 farmers who we are calling the farmer hubs. And through that, they have been able to install and utilize. So the adoption rate is fairly low, about 50%. But even with those, we have been able to realize transactions that go up to 275,000 in USD, with an average of about 100,000 Kenya shillings. And this is data that is up to April of 2023. In conclusion, as we look at the food system space, we appreciate that it's a complex space. It has lots of players, and all those players have to be actively involved and interconnected. And we see that the digital platform is an enabler to this connection, because then it helps us make real-time data, so we can collect data in real time, and we can also use the same data for making decisions. We see this as an opportunity to foster production, to enable us, or at least to enable the city populations access nutritious food. But most importantly, we appreciate that because of the digital penetration in this country, we are able to reach women, we are able to reach youth with our products and our technology. Ultimately, we see this as enabling us to make further decisions in as far as access to credit, farm inputs, as well as insurance services to this particular target population that we are reaching. That is the end of my presentation. Thank you very much for listening.
Yeah, thank you, Elizabeth. I think we can welcome a remark in a minute. Any pressing remark, someone?
Thank you for the enlightening presentation. I just have a question. What happens after, after the end of project? What measures are you putting in place in terms of sustainability? Because we realize with using apps, there is maintenance and other issues that need to be put in place for continuity long after the project is over. Thank you.
What I've done so far is the project is currently managing the app in the back end, but we are working with the farmer. So the farmer hubs are basically like agripreneurs, all right? And this data that they are collecting should help them run their businesses. So the value proposition is that they will appreciate the value of the data they are getting in terms of the other services that they're going to get. Ultimately, this will enable them buy into the app and use it for the long term. So for the moment, we have been able to, so let me just say that this project is being implemented in 3 other countries. So we are implementing this in Bangladesh as well as Rwanda. And in Bangladesh, we have been able to face it. And so farmers are the farmer hubs are using the app and they are paying for it. So for us, it is something that we are starting, and we are hoping that it can follow the same channel. Yeah.
Thank you, Elizabeth, for that presentation. We're going to be having Stephen Onyango coming in. Stephen.
Okay, thank you so much. As you see, my name is Stephen Onyango. My title for the presentation is Determination of L-ascorbic acid quantities in vegetables using 3% acid alcohol, titrimetric method. So this is basically a modified procedure that helps in determining vitamin C in vegetables using titration. So this protocol is very much relevant to the theme because it's actually showing an advancement in technology. There is an existing technology already, which is redox iodine titration, and the novel idea that we have here modifies that procedure, as I'm going to demonstrate. So the main study objective for this was, if you check the first paragraph, actually just testing the possibility of using 3% acid alcohol in that titration. There is already documented information on titration that helps in determining vitamin C quantity in vegetables, but my interest specifically was to test the possibility of using 3% acid alcohol in that titration method. But that objective is subject to probably paraphrasing if you look at it academically, depending on how you want to paraphrase it. But my interest was basically there and the objective of the study. So it's subject to change depending on how you want to look at it academically. So the main reason why I had that objective is because in the existing protocol, which is redox iodine titration, there's usually a challenge, especially in viewing the endpoint. The endpoint does not contrast with the color of the chlorophyll, which comes from these vegetables. And this is what brings in the use of 3% acid alcohol. I'm going to demonstrate further on that. So vitamin C is a very important vitamin. It's present in fruits and vegetables, and I've enumerated quite a number of uses of vitamin C. Like deficiency of vitamin C can cause scurvy. It's also important for formation of collagen, also for biosynthesis of neurotransmitters, enzymes, and also as an antioxidant in the body. And that is the reason why I'm so much interested in doing this research. So this actually illustrates the existing technology that I'm talking about, the redox titration. And what you can see here, this is showing that there's already existing information that is published on redox titration method. And the photos that you can see are showing titration to determine vitamin C in pepper. So when you do titration, as the setup shows here, you add the titran, which is iodine, into the flat bottom flask. You do titration to analyze the analyte, which is vitamin C. As you add iodine, the color keeps on changing because there's a reaction. Iodine starts reacting with vitamin C, and when that reaction is over, then the endpoint comes, which is a reaction between iodine and starch. Starch is used as the indicator solution. So the last color that you see shows the endpoint of that titration. So there's usually a challenge when you want to test for the quantity of vitamin C in vegetables. And these are some of the examples that I chose. Those vegetables, and probably a fruit like avocado, which have a lot of green color in their samples when you prepare for titration. So what you see here on the right is just simple iodine test. When you do iodine test, you add iodine to starch, and depending on the various quantities of starch, you're going to get different colors. But if you have a high amount of starch, then this is the reaction when you do iodine test. So if you check the color of the sample that would come from those vegetables and the color of the endpoint, then you will not get clarity, especially when you are doing titration. You will have a problem seeing the endpoint. And that's where I'm trying to bring in the use of that 3% acid alcohol. So these are the reagents that are used in the test. Iodine solution, that's the procedure that we used to prepare iodine, 2 grams of potassium iodide, 1.3 grams of iodine, all dissolved in a 1 liter solution. Then for 3% acid alcohol, 3 ml of hydrochloric acid was dissolved in 100 ml of water. All that is explained in that statement. Then starch, we prepared 0.5% weight by volume starch. Because we are preparing 50 ml, we only dissolve 0.25 grams of starch. Then vegetables and fruit samples. We tested vegetables because that was the main area of interest, but as a control, we used orange. Because when you are testing orange, there's no problem. They don't have the chlorophyll, the juice from the orange. So we showed the results that you'd get when you're testing orange, but also demonstrated that there's a challenge when you're using vegetables. So samples from those fruits and vegetables, we took 100 grams and then used it to prepare 200 ml of the sample. So that is the procedure of titration. So from the 200 ml of the sample that was prepared, we only took a 20 ml aliquot of the sample. So for the fruits, before titration, we were diluting the 20 ml with 150 ml of distilled water. But for the vegetables, we wanted to demonstrate the applicability of this 3% acid alcohol. So instead of diluting with water, we were diluting with 150 ml of acid alcohol. We are struggling to eliminate the chlorophyll so that we can have the endpoint clarity. So that's still the procedure for titration. The indicator solution used, and then titration with the iodine solution, and achieving the 0.1 ml range between test 1, 2, and 3 of titration. So I used SPSS to analyze the data, and this is how the calculation was done. From the equation, if you can see this equation here, ascorbic acid reacts with iodine molecule to produce 2 iodide ions, and dihydroascorbic acid, which is formed from ascorbic acid as a result of oxidation. Then we determine the mass from 20 ml of the sample, and because 100 grams of the sample was dissolved in 200 ml, we finally determine the mass in 200 ml of the sample. And then, though the data was not so much packed, but at least as a confirmatory test, we did a t-test, a 2-sample t-test to confirm any significant difference between what we got and what is already published. So this is the data, but let me just move. I'll show you that as we move on. So this is a practical example. The fruit, the orange fruit, so that is the juice from the orange, and this is the color that we get at the end point. It's very easy and straightforward when you do titration on orange. So that's the color of the end point. So immediately you get that color, you stop, you get the titer value, and you determine the mass of ascorbic acid in the given sample. But there's a problem here. When you are testing a vegetable, you see that kind of a color. It doesn't contrast well with the color of the endpoint. So that necessitated the use of acid alcohol so that at least you decolorize that chlorophyll before you can begin titration. And we realized that when you add the 3% acid alcohol, this is the color that you get. Now when you begin your titration, the endpoint becomes very clear. So the protocol is slightly different from when you use orange, because for orange it's very simple. Endpoint is very clear, but for vegetables, you have to struggle to remove the chlorophyll before you can determine the endpoint clarity. So it worked very well for us, and that is those are the pictures that we took as we were doing the tests. So these are the results using, as we were testing the collard greens, the spinach, the orange, and the green pepper. These are the titer values, the moles of iodine, the moles of ascorbic acid from the reaction, the mass in grams. Actually, this was mass in, this is grams, because to determine mass reacted, you take number of moles and multiply by the relative formula mass, which is actually in grams. So we converted that to milligrams because we wanted our results to be in milligrams, preferably in milligrams of 100 grams of the fruit. That is the standard way always of documenting the masses. So we had to convert the mean to that. But all these were done in Excel. We were doing this in Excel using mathematical functions as opposed to doing calculations on a pen and a paper. So these are the results that we got. On the left, we have the mass of ascorbic acid. Also on the right, we have the mass of ascorbic acid, but from USDA data. This is United States Department of Agriculture data that's already published. We were trying to compare with what we were getting in the lab. And this is why I was telling you the data is not so much packed. Yes, the data is not so much packed, but at least we were just doing a confirmatory test to prove to you that what we did in the lab is not so much different from what is already existing in the database. And therefore that proves that our protocol is efficient, because as you can see, there was no significant difference between the two sets of data. That is also showing the same thing. You can see the ranges are very small. That confirms similarity. So our conclusion is that 3% acid alcohol proved to be efficient in decolorization, not decolonization. Decolorization of chlorophyll to achieve a clear endpoint during titration of vegetables. Thank you for listening.
Thank you very much. You can give him a clap.
Good afternoon, everyone. My name is Stephen Achieng, trained at Mawego Technical Training Institute, one of the renowned TVET colleges in Kenya. So I'll be doing a paper on the role of TVET programs in attaining sustainable development, Goal 12. that is sustainable food processing practices. So we looked at some of the selected TVET colleges in Kenya, those that offer food processing as a course. So we wanted to look at how the students that do this course perceive food sustainability, the processing practices, as they study. So TVET is one of the robust training institutions that nurtures our young ones to become role models in future in terms of food processing. So when we looked at this paper, we found that one of the things that the United Nations has adopted is a Sustainable Development Initiative that was titled Transforming Our World, the 2030 Agenda for Sustainable Development in the face of poor resource use for human consumption. So that was adopted by the United Nations. So this was to be implemented in a 10-year framework to ensure that there is sustainable consumption and production. And in the Agenda 2030, we have the Sustainable Goal number 12, which talks of sustainable consumption and production. So the target was to effectively manage the uses of natural resources and also to reduce food losses at the retail and consumer level from farm to fork. So the 12th goal, Agenda 2030, also targeted the reduction in chemical and any related waste along in the food processing system, which can impact human health and also can also cause environmental degradation. So this reduction of wastage is suggested by practicing prevention, reduction, recycling, and reuse of any raw material which involves natural sources that can be diminishing the level of carbon footprint creation. It was also important to ensure that companies who are the key players and policymakers practice sustainability as part of their daily practices in the effort to ensure that there is a sustainable development. So when you look at the statement of the problem, you are saying that there is unacceptable food loss along the supply chain that accelerates carbon footprint released to the environment. So food losses also exacerbate food insecurity. So when there is food loss along the processing chain, we find that it also leads to food insecurity to household levels and even to the country at large. So considering this, there is an exponential spiraling of global population. So as the population continue growing and there is also increase in food loss, then there is likely to be acute food shortage, that is food insecurity. So to curtail such food losses, there is need to inculcate in learners the principles of poverty eradication and management of national resources that is envisaged in Sustainable Development Goal number 12, that is sustainable consumption and production. Therefore, identifying sustainable practices among TVET students will accelerate the current requirement and interpretation of legislation framework for environmental protection, as well as assuring seamless food production with limited food loss. So we are saying that when we bring this to the attitude of the learners as they learn, such that when they get into the field, they are able to ensure that there is no much food loss, and we are also able to ensure that there is increased food security and there is also reduction in environmental degradation. So the objective of the study was to investigate the level of sustainable food processing practices among students of TVET colleges in Kenya, those students that do food processing as a course. So the research question was to what was the level of sustainable food processing practices among students at TVET colleges in Kenya. So those are what this study sought to look into. So the design. So this study was conducted using a descriptive quantitative approach to identify the empirical evidence related to food processing sustainability practices among selected TVET colleges in Kenya, those that offer food processing as a course. So the quantitative research was conducted based on the philosophy of positivism that examines a sample or population which aims to specifically test hypotheses for a phenomenon. So this study was conducted using a deductive descriptive design through a cross-sectional survey questionnaire by finding the relationship between two or more factors such as conditions, situations, problems, issues, or attitudes for the study. So when you look at the sampling, so currently there are 8 TVET colleges that offer diploma in food processing as a course and quality control in Kenya. So out of these 8 TVET colleges, when you look at the population, we found that the total population for this student was around 525. So we went ahead and used a stratified random sampling. So we selected this according to their zones where these TVET colleges are located, and we considered students who were the age of 18 years. So this age of 18 years, we were assuming, or we perceived that they had already received instruction, and they are also able to respond to the dimensions of sustainability practices, being that they are doing that course at their level. So the justification for our population was that most of these students will be practitioners in future, and therefore they will have to put this into action. So when we train them, and when we also put this into their training at this level, then they are able to adopt this even when they go into the field. So we did a self-administered research that was online. So the questionnaire was distributed to the colleges, and out of that we found those that responded. Out of the 227 that were sampled, only 225 respondents did the full questionnaires, and that is what was analyzed for our study. So we used IKPROM, that is an instrument of sustainable food processing. So this one was used to test the validity and reliability of this study. So we also find that this instrument approved through the content validity by 5 expert panels, and we were looking at sustainability, food technology, and also food processing. So we also used SPSS to analyze the data and the descriptive analysis. We compared the means and the standard deviation of each item, and we had a total of 23 items that we used to evaluate the sustainability food processing practices. So our instrument consisted of 3 sub-constructs. That was during the pre-processing, during processing, and processing as well. So we are going to look into that in our study. So we used an exploratory factor analysis where each item was measured on a 5-point Likert scale, where 1 was indicated as never, very often, number 5 was very often, to show the frequency of how the respondents regarded the items that we listed for our study. So when you look at the results, so on sustainable food processing, found that we had a mean of 3.67, and that was considered as moderate. And when we also looked at processing, it was highest with a mean of 4.20. Then post-processing was also moderate with a mean average of 3.17, and pre-processing at was lowest at 2.97. Then we can say that when we compared our study with other studies that has been done on the same, we find that there is still need for sustainability processes, which aims at the good manufacturing practices that we have according to the items that we have. So the best practice is a practice that can be transferred to others in achieving institution or organization targets. So the awareness can be raised through the students, through knowledge given, and even the training that we give them periodically. So since TVET colleges provide training in technical and vocational education, the practice of sustainable food processing is most likely to emphasize on practices among students in their workplaces now when they get to practice after schooling. So when we fail to separate organic and solid waste, both inorganic, after social and environmental sustainability. So we should foster an understanding on how to handle the organic waste prudently, and also being able to stimulate the technological improvement and also to innovation among the society in general. So this is what we ought to give the students, so that when they get to the field, they are able to handle this. So this study also gave students college an opportunity to understand the handling and the management of organic solid wastes, and so that this can also get into their attitudes, such that as they handle this during processing, at post-processing, and even during pre-processing, they are able to know how to handle all this. So to conclude, we found out that food processing practices among TVET students showed a moderate level of practice, and therefore attention should be given to any activities that involves preparation of raw materials, management of waste from organic raw materials and solid waste that has direct impact on the environment. Then lastly, sustainable food processing practices must also emphasize on hygiene, safety aspects, because sustainability involves wider aspects, including safety of the product along the food chain. Then this study also recommended that TVET colleges also need to emphasize on practices of optimization of natural resources during product production, followed by avoiding improper product handling. Then solid waste during processing activity must be managed proactively to reduce environmental effect. And also students pursuing this course in TVET level should also be alert to the chemical or raw material used to keep food safe in the impact towards the river and the land, that is on where they get to deposit the raw materials and the waste product. That brings me to the end of my presentation. Thank you.
Thank you.
I was asking that did you manage to link this to the existing curriculum for training? Were you able to identify if there is gap, maybe existing in practice? Is there a gap in the curriculum? For example, are they having courses around IPC, infection prevention control, or something on hazard analysis, critical control points? Are they taking it so that you can link it to practice? Or there is no gap in curriculum, but there is a gap in practice?
Thank you, Professor. From our research, we found that there are several gaps that need to be widened. For example, the one that you have talked about on prevention of infection. I think these are some of the things that we are recommending for the policymakers and the curriculum developers to come in and also bring in these courses, so that these students at their level in TVET colleges, they are also able to harmonize all these courses at once, so that because the current curriculum does not provide for the gap that we are talking about. So we are hoping that these policies that we are, the recommendations and the policies that we are putting in place with the KICD, they will be able to integrate this into the current curriculum that we have. Thank you.
Thank you. Thank you for that. Let's give him a clap as he sits down. Thank you very much, Stephen. We shall be concluding that sub-theme by having Violet Musau.
I'm Violet Musau from Kenya Methodist. I'm doing a presentation on technological approaches. Currently, our food system is facing challenges in population growth, resources scarcity, and economical constraints. However, the emerging technological approaches can offer transformative and innovative solutions. My objective was to investigate the impact of technological innovations on food systems, aiming to understand how the innovations can rechange, improve various aspects of food production, distribution, and consumption. I looked into several approaches and methods, among them vertical farming, whereby vertical farming is farming using less water or no soil, or using less soil and less water. Factors that were to be considered on vertical farming, we have environmental factors like artificial light, humidity, temperature, and biofortification. It incorporates farming techniques, the first being hydroponics, aquaponics, and aeroponics. It also has its own disadvantages and advantages. Among the advantages, it uses 70 to 95% of water compared to the traditional farming. The traditional farming nile ya kawaida. The vertical farming is farming in verticals. My picture can show you. I don't have to explain much. Sindio? It uses less or no soil, and consumers can get fresh products. It also requires less land. On the disadvantages parts, it's a bit costly, and then there's no cross-pollination, but that can be solved out by planting flowers. My next method was insect farming. I won't talk more about that because Dr. Okeyo has already talked more about that. The next approach was on use of mobile payment platforms, whereby they have revolutionized the way food transactions are being conducted. The next one on online food marketplaces. They are gaining popularity nowadays, connecting farmers directly to the consumers. An example I can give, we have Zushini and Green Spoon in Kenya. The next method was on solar-powered irrigation, whereby they have been deployed to address the issue of unreliable access to electricity in rural areas. The next one was on food waste reduction technologies. They have been introduced to reduce food wastage. This is particularly important in a country where a significant portion of food goes to waste. And then on the climate change, on the climate smart agriculture, this includes the use of resistant crop varieties and weather forecasting tools. My real emphasis was on vertical farming, whereby it can be used by the upcoming TVET institutes. Most of our developing institutes are in towns, so they can use the vertical farming because they have less land. On the conclusion, embracing technology isn't precisely an option, but it's necessary for a sustainable food system and well-nourished society. And that was the end of my research.
We don't conclude the morning session by having two poster presentations, one on NCD and the other on MIYCN. So I'll invite Purity Chemgetich.
Thank you very much for giving me this opportunity. As you've been told, I'm Purity Chepngetich, and my research was about our experience with 3 patients on management of obesity and diabetes with diet and aggressive weight loss. I want to acknowledge the co-author of this research was Dr. Lois Wagana, consultant physician cardiologist at Mountain Springs Medical Center, Nyeri. The keywords in this study, we have a diet, we have random blood sugar, we have the HbA1c, which is the glycated hemoglobin test. And the background of this study, we have a food system, refers to the elements and activities related to producing, processing, distributing, and consuming food and its effect in our day-to-day lifestyle. Diet and lifestyle therapy is the cornerstone therapy for healthy living, especially for patients with obesity, diabetes, and cardiovascular diseases. As I was writing this study, I discovered that most people who have cardiovascular diseases, it's because of the lifestyle or the living of sedentary lifestyle. So when I sat with them and discovered that there are some issues with their health, I went ahead and used some of the results that were used, the random blood sugars. So this article gives our practical experience on management of obesity and diabetes with diet and aggressive weight loss. The components of healthy lifestyle therapy includes a package of reduced calorie intake and increased physical activity and patient education. I want to challenge you as nutritionists and other cadres that what is your physical activity and what is your dietary intake in your day-to-day activity. Methodology. This was a cross-sectional study conducted at the Mountain Springs Medical Center, and this study utilized a clinic database of 100 persons with type 2 diabetes from a period of June 2022 to May 2023. And general information obtained from the patient records included the gender, age, weight, height, BMI, random blood sugar levels, HbA1c, and nutrition intervention. As I was coming across, also as I putting across this study, I realized that most ladies were obese compared to men. Results. Moderate exercise helped increase insulin sensitivity, and we opine as a result, the blood sugar levels drops. So most patients who had type 2 diabetes, when they did a lot of aggressive exercise, the blood sugar was able to drop. And also those patients who are obese, they had consumption, lunch, and even supper included a lot of starch. And most ladies have, I think, have a problem with this. Consumption of high starch diet could possibly elevate the blood sugar levels. As I was interacting with the patients, I realized that most patients, they consume a lot of starch, or those patients who had type 2 diabetes, their blood sugar levels was able to increase. Having a BMI less than 25 kilograms per meter square aids in controlling blood sugar levels, especially for type 2 diabetes and pre-diabetic patients. And then the HbA1c also increases with increasing blood sugar levels. So an HbA1c between 5.5 to 6.0, these are for pre-diabetes patients, and an HbA1c of 6.5 and above are for those patients who have diabetes. So for a person who has a normal weight, a person who has a normal healthy lifestyle, has a HbA1c of 5.5 and below. So I want to challenge you that also you have to do that test. As you go back from this conference, go and see where do you weigh. Do you weigh from the normal person? Are you pre-diabetes or are you diabetic? Okay. From the graph, the HbA1c increases with increasing blood sugar levels. Also, the BMI drops with the reduce of chronic consumption of starchy diet. And also physical inactivity increases the rise in blood sugar levels. And high carb diet increases the random blood sugar levels. And low carb diet reduces the amount of sugar levels in your blood. Conclusion of this study. The results found a higher prevalence of type 2 diabetes with a BMI of 25 kilograms per meter square, and the prevalence increased with increasing BMI. An HbA1c of more than 5.5% to 6.49% strongly associated with chronic consumption of high-starch diet with physical inactivity. Maintaining a low-carb diet is the backbone on controlling blood sugar levels. Moreover, it significantly enhances our weight loss. That's the end of my presentation. And I really like to encourage most specialists to really employ or include nutritionists in their clinic so that we enable patients to have a good lifestyle, and also to ensure that most patients who have diabetes and cardiovascular diseases can be able to be as.
Good afternoon. My name is Cheriot Sambo, one of the poster presenters. Now I have my poster here. You will be able to interact during the lunch break. So more details you will be able to see in my poster. So first, I work as a trainer. at Rift Valley Technical Training Institute. I've been training for the last, in different institutions for the last 14 years. And I've been working as a clinical nutritionist for 11 years. So I understand both clinical and now when it comes to training. Also, so factors associated with early initiation of complementary feeds in Kapkatet Hospital. It was an hospital-based study among breastfeeding mothers. So the study area, which is Kapkatet, as you are aware, in Kenya currently we have more than 40 tribes, sub-tribes, and different cultures, which really affects most of our policies implementation. Like breastfeeding vary. When you go to one county to another, so Kalenjin are the resident in that. So the Kalenjins, majority, 99% were the resident in that area. It might not be so much visible because it's a poster, so you will be able to check clearly. But let me just go through findings regarding exclusive breastfeeding. So just to mention, exclusive breastfeeding rate, as recommended by WHO, requires that we have exclusive rate of more than 90%. But globally, the rate is at 41%. That is the global. And in Africa, we have global, the African rate of exclusive breastfeeding at 43%. And in Kenya, the KDHS 2022, we have at 60%. And KDHS finding 2014, it was 61%, which was a great improvement from 32% from the KDHS 2008. So we reached 61%, we came down, now at 60. Compare ourselves with other countries like Rwanda, which has around the KDHS, their demographic health survey show that Rwanda has 84.9. Burundi, also our neighbors, 69.4%. Uganda, 63%. And now the Tanzania, our neighbors, 50% of exclusive breastfeeding rate. So why are we lacking behind as Kenya? We are now dropping from 61, we are at 60. In my study area, we found that a huge number, that is 70% of under 6-year-old children initiate early complementary feeding. So most of the associated factors which we found out, one of them was the level of education and also early marriages. Majority of the mothers were dropout, the teenage pregnancies, and return to school. Others return to work. It was associating factors. And most of the finding also, the associated factors were the cultural practices on herbal medication, which we found to be, it was significant in our study, that most of our young infants, they are initiated on herbal medication, which sometimes interferes. And also, now this is my poster. I think, yeah, that is the one. So most of the factors which we found out, there was why these mothers initiated breastfeeding, complementary feeding earlier than the required WHO recommendation at 6 months. So most of them were saying due to pain during breastfeeding, that is the young mothers, mother-in-law pressure to wean their children early, so there was pressure. Then another one was the babies not getting enough breast milk. So it was cutting across most of the mothers, even the most educated, those who went up beyond. Now the conclusion of our study, and I'll go straight to recommendation so that I don't take conclusion. So our conclusion, that there's still a gap that we have to meet as healthcare providers and all the stakeholders in terms of bringing the rate of exclusive breastfeeding to the required 90%, which is still a wide range from where we are now. So in the study area, our conclusion, more information has to be packaged in a proper way so that they change the beliefs and attitude of breastfeeding women so that they practice exclusive breastfeeding up to 6 months as required by WHO. So some of my recommendation and conclusion are there, you will be able to see. So I'll not be able to say everything because of our time. Maybe I'll just leave. So
we can still interact with the post.
Yeah, you will be able to interact so that when you have any other question regarding our study, you'll be able to reach back to me. And I said earlier, most of the professors who are here, Dr. Okeo and the rest, I know most of our studies for publication, it is mostly kept in the shelves. And recommendation that we make are rarely used. So most of us, we have not been able to use this information to inform the policymakers regarding those issues.
Let me ask you a question.
Thank you.
If you were to tell the policymaker the outcome of your study and how it can influence policy, what area of policy would you focus on and how would you say it?
Okay, given a chance, I think we need to embark more on primary healthcare so that we start at a lower level of health facilities and even to the community, the level 1, where these mothers are. So advocacy in those level 1, even the churches or any congregation, even we teach in primary school, so that this information is well packaged, so that when children are growing, they have the information and the need for this exclusive breastfeeding.